We have Senator Dan Sullivan joining us from Washington, D.C. We're really excited to have him, so let's give him a round of applause.
Let me first thank everybody. It looks like a great conference. I was looking over the attendees, and it's a lot of everybody. I certainly have a lot of respect for in the room. A lot of my friends are actually in the room. I won't name them because I don't want to embarrass them. But and I do want to just mention, you know, from my perspective, the deep respect that I feel towards our medical community in Alaska. I tell this story a lot. You know, over the last 10 months, we've been working on these issues with many of you pretty much nonstop. I like to remind people I was actually pre-med in college until my sophomore year when I was taking organic chemistry and decided maybe I couldn't get through the curriculum, so had to choose a different career path. So I know the doctors in there certainly all smarter than I am. And on a more serious note, you know, when I talk about respect for our medical community, two of my daughters were born in Providence, and one went through a very difficult delivery with my wife. I still get a little teary-eyed when I think about what the neonatal team there did for my family. So nothing but the deepest respect. So what I wanted to do, and I actually like the kind of mentioning of what we were doing here in the intro in the document that talked about we have been working hard on this. We have been, to be perfectly honest, kind of behind the scenes on the healthcare reform efforts over the last several months. But it's the number one issue I've been focused on really in the last year in the Senate over anything else. Military issues, economic issues. It's been healthcare, healthcare, healthcare. And again, I want to thank everybody who's really helped us understand this a lot better. Let me provide a few thoughts, and then really want to try to open it up for any questions or, importantly, suggestions. These are some of the assumptions, and again, that I've learned from so many of you that we're working under as we have looked at trying to make progress on making our healthcare system in Alaska and the country better. One is, I think when you look at our system, both in Alaska and across the country, I don't think the status quo is working. I don't think the status quo is sustainable. We can talk about Medicaid, critically important program, but if you look at the finances and the long-term sustainability of that program, which has tripled in terms of its spending since the 1990s, it needs to be put on a sustainable path. There's a lot of talk in the state about what the governor and his team are doing in Juneau. Rarely do we talk about the $20 trillion in debt that we've run up on our kids' backs and programs that need to be put on a sustainable path so that future generations can actually use them. Difficult discussion. No one really wants to talk about it, but in my view, it's important that we do, and we've tried to in a number of ways. Second, on the Affordable Care Act, no doubt that many Alaskans, many Americans have received coverage that they wouldn't have without it. But I also think that, again, an issue that doesn't get focused on enough is that what was promised when this was sold, and you know all the promises, none of these have also been kept. So I'm just going to give you a small smattering of what I hear on a very regular basis from our fellow Alaskans in letters and emails to me on some of these issues, particularly folks in the individual market. Let me give you just a couple emails and letters that we've gotten. One, quote, "My wife is a small business owner. I stay at home with 2 small children, soon to be 3. We are currently paying $2,000 a month, more than our mortgage in terms of premiums. We are currently looking at the option of not having coverage, as the penalty of 2.5% of income would be a drop in the bucket relative to our $26,000 we pay a year before we get insurance. Another, we are currently paying $2,778 per month for Primera Blue Cross health insurance, the only carrier in Alaska. It is the lowest rate available to us. We are both 60 years old and in good health. Please help us, Senator. We cannot afford this premium. Another, all recreational money is gone. We are carpooling to cut down the gas bill as much as possible. We are paying the premium on our credit card debt that will now take much longer to pay off. We are keeping our heads afloat with no clue how we will afford birthday presents for our twins in March. Our middle-income family with a husband that owns a successful small business is now paycheck to paycheck, praying nothing breaks down that requires fixing. Please, Senator, can you do anything to help us who have no choices in healthcare right now? And finally, quote, because I live on a limited budget and am 3 years shy of being a Medicare eligible, my premium after subsidies will increase threefold and my deductible will go from $750 to $5,250. Please tell me how I'm supposed to do anything other than live in my home as though it is a prison. I used to be able to afford to go snow machining. I used to be able to take a vacation. Now I can afford to live in my house like a hermit and wonder how my government can destroy everything I've worked for towards, quote, affordable care. So I'm not saying anything that is not new to any of you, but I receive these kind of letters, and I receive positive letters, but I do think that on the status quo, it's not working. So what are we doing? How are we thinking about it? You know, you've seen that the Senate's Better Health Care, what we were calling the BICRA, and then the Graham-Cassidy, these have been debated. They haven't passed. But what I want to mention to you, I think that process, and the process hasn't been good, I'll be the first to admit that some of the ideas that we've been focused on have been making, I think, a lot of inroads, particularly ideas that relate to Alaska. So in terms of principles, as we've been looking at this legislation, as we look at other legislation moving forward, I would focus on a couple. One that I think most people can agree with is the importance of additional state control. I know there's been some discussion with folks in the room about our capacity, but I do think that the state of Alaska, our legislature, our governor have a better sense of addressing the specific issues in Alaska than federal government employees in Washington, D.C. I think the 1332 waiver, which our legislature and the governor did a great job on, we were encouraging the Trump administration to approve that. That's one example of additional state flexibility that can help us. And I think that's one example of something that we're going to continue to press for that I think most Alaskans would agree with. Second, we certainly are looking at the national challenges that we face with regard to healthcare, but I will tell you from my position, what I've been trying to do throughout this entire process over the last year is educate my colleagues in the Senate on Alaska-specific challenges. We have challenges that no other state has, and how through national legislation, they can help us address them. And again, even though these bills haven't passed, I think we've made significant progress on these kind of issues. Let me just give you two examples. In the earlier version of the BICRA legislation, we had a provision in there that we drafted and got in, convinced everybody from Speaker Ryan, the Vice President, McConnell, all the other leaders in the Senate on that 1% set aside for the innovation funds. These are large funds, 15, 16 billion, 1%. Was set aside for states with significantly high premiums that could go into their reinsurance, that can go into other provisions in addition to the 1332 waiver. That would have been an Alaska provision, right? That I think would have helped our individual markets significantly to the tune of about 150 million additional from federal money supporting our efforts to make our health system more costly or less costly, and to be able to deliver to all Alaskans. The second one, and some of you worked with us on it, but in the Graham-Cassidy bill, we had a provision that brought what I called FMAP, the federal match in Medicaid, equity. As all of you know, right now the formula for the FMAP is simply a per capita income formula, period. We have the lowest FMAP match, the lowest match at 50% than any state in the country. And I made the argument to my colleagues saying it shouldn't just be per capita income. It should also look at the cost of healthcare in the state, the cost of living in the state. And what we were able to do in that was to get a whole new section in that bill, essentially saying that the formula should look at not just per capita income, but the cost of medical care, the cost of living in the state, and that would have moved our FMAP from 50 to 65%. The CBO did a budget score on that, was about estimated about $4 billion for Alaska. That would have been very significant for us, and I think it would have been good policy, and we convinced the vast majority of our colleagues on the Republican side to vote for that. So we're not there yet on these, but I think we're making progress on explaining the challenges in Alaska and what we need to do to address them. Let me just mention one final issue, and then I'll conclude. The other thing that we've tried to do here, and I really, really appreciate it with so many of you, is that we've tried to get out to the community, meet with you here, meet with you back home, hundreds, if not thousands, and listen on what are our specific issues beyond the ones that I just talked about. Many of you know the issue of the opioid addiction and mental health are big challenges that we have in our state. They're big challenges throughout the country. I was at a opioid task force meeting in the Valley in the spring, and someone raised a really important issue. They said, I'm in long-term recovery. I have a great job opportunity that was just presented to me. I'm on Medicaid expansion, but I can't, if I take the job, I won't be able to continue to get my treatment under Medicaid expansion because I'll be making too much money. So, Senator, has anyone thought about maybe decoupling treatment from Medicaid expansion, so if you do have the opportunity to move up the chain, you're still not foregoing treatment? I thought it was a great point. It was right in the Matt Sue. I came back to Washington, worked with a few senators on this, pitched this to the president, pitched this to a lot of other senators, told this story, and you may have seen in the BICRA legislation, we were able to get in a huge fund, $45 billion, to address mental health and opioid and other addiction problems. And it was based on this idea from the Valley. And we're going to keep working with all of you on those kind of ideas because people are listening. And I still think there's going to be a lot of opportunities here. Finally, I would just mention that I think kind of strategically where the country is that we're at kind of a crossroads with regard to legislation as it relates to medical health care issues. As I mentioned, I think most people would say the Affordable Care Act has a lot of challenges, and we're trying to address those. But right now you're seeing kind of two different philosophical views on how to address these issues more broadly. Graham Cassidy is premised on taking the federal dollars that exist under the Affordable Care Act and send them to the states. In our case, it was actually more than exists under the Affordable Care Act, and then let the states design their healthcare systems. And then you have my colleague Bernie Sanders and 15 members of the Democratic Party, 1/3 of the members of the Senate on the other side of the aisle have recently co-sponsored legislation that would get rid of private insurance and put our healthcare system into a system that is controlled and run by the federal government. It would cost trillions, tens of trillions. It would take the private market. I think there's about 165 million Americans who get their insurance from their employers and move them into a government-run system. And that's really, in some ways, the kind of broader strategic crossroads that we're at. We're going to continue to debate it. I commit to you, we're going to continue to work as hard as we can. I read all these bills. We try to edit them. We try to get smart on them, but we can't do it without your help. And I just really want to thank you again for all that. And thanks for putting this conference together, and look forward to a few questions.
Yeah, I appreciate it. Let me start by saying I think that you have done, regardless of what one thinks about policy positions, I think that you have done a very admirable job, and I think perhaps top of class in terms of trying to attempt to explain this process to Alaskans, meaning I think that few other senators and certainly few other members of the House have done as much to try to explain your position. You put out a 14-page memo here recently that we featured at State of Reform that was a very detailed epistle on your platforms. Let me first ask, what has this particular issue been like for you as a senator, as a person, compared to other issues that you have worked on in the Senate? How has this one been different?
Well, I appreciate the comments, DJ, and you know, you called it an epistle. My staff called it the opus, and there was a lot of internal debate on that. And I was very much of the view that, look, this is a really important issue. My team and I, we put a lot of effort into it, but most importantly, so have a lot of Alaskans. They've put their heart and soul into advising us, sending letters, like I mentioned at the outset of my remarks. And so as opposed to just a, one pager, which is important to communicate, we sent that 14-page opus or epistle to over 25,000 Alaskans. And, the idea, a lot of people said, oh, no one's going to read it. I actually thought otherwise. I thought this is an important enough issue that we wanted to explain the details, the challenges that we saw for the state and nationally, and then how we were trying to address them in a very kind of, some people might say boring, but I'm hopeful that a lot of people did read it, because I think that, to answer your question more directly, I'm very focused on economic issues. I'm very focused on military issues. I just came back from a hearing with the chairman of the Joint Chiefs and the Secretary of Defense. Healthcare is so different because it's so personal. It's so personal. And, and it's very complicated. So that's why I thought it was very important that my team and I, just dug into this again with all of you. I mean, there's so many people in the room, and I won't read the names, who we've worked closely with, who we've tried to listen to. Yes, there's been disagreements, but we always try to make sure it's respectful disagreements, and we're all kind of pulling on the same oar for what we think is important for our constituents, particularly in Alaska. The other issue that makes this so different, we're different in a lot of ways, our great state. We have challenges on things like infrastructure. We bring, for example, to the table really strong attributes, like I said, on the military stuff. We're such a key state for the defense of our nation. But on healthcare, we are off the charts on so many categories relative to other states that a huge part of what I spent the last 11 months doing is day after day, hour after hour, explaining to everybody who would listen to me, whether it was the president or Paul Ryan or Mitch McConnell, the secretary of HHS, who, by the way, I think is a big loss for Alaska that he resigned recently, because he's already been up to the state. He knew more about, he was ready to launch a pilot project just on us.
Do you think this issue of health policy is perhaps should this be a bipartisan issue, as Senator McCain and Senator Murkowski and Senator Collins have all suggested, and others? A number of U.S. senators have suggested at least the process should be bipartisan, but that to have a long-standing fix, the bill should probably have bipartisan support. Or do you think that Speaker Ryan and President Trump, in their statements, that this should be mostly a Republican process? Do you think that that is the right pathway forward?
Well, look, in my view, I think that if you can make something bipartisan in the Senate in particular, it has a much, much better chance of passing. One of the things that whenever I talk to the media, I always try to emphasize that there are a ton of things that happen here on big, important legislation that's bipartisan. It doesn't always make the the press and the media, because I do believe there's kind of a interest in the media on kind of, hey, where's the conflict and where's the battle? So my goal certainly would be to have bipartisan legislation. I do think that healthcare is an area where it's more difficult. Let me just give you a couple examples. And I don't believe in, hey, tit for tat, but the legislation, the Affordable Care Act, started out as partisan legislation. So that's just a fact. That's the way it came into being, which is part of the history. And one of the things, and there's a number of Democratic colleagues that I've talked to about a bipartisan approach on healthcare. I still think we can get there on key things like costs and bringing down costs that are something that's so important we haven't even looked really hard at in this bill. But on anything that relates to the Affordable Care Act right now, for example, the individual mandate, the employer mandate, which when I talk to Alaskans back home, they're very focused on saying, hey, we think those should go. The Cadillac tax. When you try to go after anything that relates to the ACA, right now, there's no appetite on the other side, none. And so it makes bipartisanship on this issue, if you think like I do, that I think we should get rid of the individual mandate. I think we should get rid of the employer mandate. I do think there are elements of the Affordable Care Act that I think we should keep, which is what I try to explain in that long letter. So the pre-existing conditions, the children on their parents' insurance till they're 26, the lifetime caps, those things are important elements that I think we should keep. But when you look at certain issues with regard to the Affordable Care Act right now, and you try to change them, there's no interest in the other side. So I think bipartisanship is very important. I think on healthcare, it's challenging. And as I mentioned, I really think at this crossroads idea, the fact that there's a lot of steam for the government-run approach that a lot of my colleagues on the other side of the aisle are now behind, including pretty much everybody looks like they're going to run for president in 2020. I think that's going to be tough to get bipartisanship for. I'm not a supporter of that approach to healthcare at all.
Most healthcare, whether it's provider or payer side, most of that is regulated, happens at the marketplace at a state level, whether that's insurance regulation or certificate of need, all of these sort of different acronyms. Alaska, I think, is unique for a number of reasons. One is that it is deeply engaged and in some ways supported by the federal government more than other states. There are a host of reasons why that's the case. Do you think philosophically that fixing healthcare in Alaska should be primarily, not totally, because I know the answer is all of the above and collaboration is paramount, but is the primary line of attention or action, should that be at the state level or should it be a federal issue? Is solving this more an issue that the governor should lead on, or is this more an issue that the federal delegation should lead on?
Well, look, I think it's, and it won't surprise you that I think it's a combination. But my approach on this, and we had a lot of good discussions with the governor and his team. They were all down here last week, the whole team. We've worked super closely with Lori and Val Davidson, and I know Lori's going to be speaking later. My approach is very much, and I'm unapologetic about this. We have these big challenges that no other state has. We have cost structures and infrastructure challenges that no other state has at all. My approach has been, to the extent possible, the way to design the system should be left to the governor and the state legislature, because they understand our challenges better than anybody. And one thing that Lindsey Graham made a really strong argument on when he was talking about Graham Cassidy, if you have a challenge right now with the Affordable Care Act, who do you go to in Washington to try and fix it? I mean, I've been here 2.5 years and I barely know the answer to that. if there's an Alaskan who's got a challenge on the Affordable Care Act, it's a very federally run program, or, if it moves further towards Fed control, like the way Bernie Sanders wants, who would the Alaskan who's got the problem go see in the giant bureaucracy? Nobody knows the answer. If it's more state focused and state run, people know who to see. They know who their state legislator is. They know who their governor is. And there have been a lot of innovative state programs that have helped make states' health insurance programs and delivery systems run in a way that's much better, much stronger. So that's kind of my overall view. But I would say there's two kind of exceptions to that. One is I have no problem, and I've tried to do it, and I provided some examples, making the case to my colleagues in the Senate that it's not a buy-off for Alaska, but that we have unique challenges that require additional federal support. And to be honest, this is one area where I think we've made a lot of progress with Republicans and even some Democrats. That FMAP provision I talked to you about, that would have included Alaska and Hawaii. Well, I went to the Hawaii senators and explained what I was doing. You should have seen their eyes widen about, wow, that would be great for us. So I do think there's a case to be made, and I've been trying to make it that we merit, given our situation, additional federal funding that maybe other states don't have. And then another element where I think the federal nexus is going to continue to be very important, actually a real bright spot of our Alaska healthcare delivery system, and that's the Alaska Native healthcare system. And one of the things that we tried to do in all this legislation is make sure that all of the advancements in previous legislation with regard to Alaska Native health delivery systems were not touched. And those are important developments that we're going to try to safeguard. We were successful safeguarding those in the two previous legislations or bills that came to the Senate floor, and we'll continue that. So it's kind of a hybrid answer to your question, but I think it fits what we see as our unique challenges.
After BICRA, it appeared that there would not be any additional legislative activity for some time. Graham Cassidy was still, it was still floating around. Now that Graham Cassidy has I guess, been put on hold, I'm not aware of any significant alternative legislation that might arise. The reconciliation bill has expired. Tax reform is now teed up. Senator Hatch, who runs finance, is not likely to take up any additional hearings. Senator Alexander is still trying to figure out what he wants to do and help, I think. Do you expect that we will see any additional significant legislative push out of the Senate on health policy, at least for the remainder of this year, or even ahead of the 2018 election? Are we going to see more of these battles, or are we probably going to wait until the election in 2018 and then reassess?
So my view on that, DJ, would be nothing by the end of this year. But we'll see what happens next year. I think Graham and Cassidy are very interested in trying to make another push with a much more robust process, because there was a lot of issues. Look, I even had issues with regard to we weren't getting the data we needed, and so I had never kind of made a full commitment on that because we weren't getting all the data that we needed working with the governor's team and Senator Murkowski's office. But I will say some of it depends on what happens in additional markets throughout the country. Right now with our 1332 waiver, and again, I want to compliment Lori and the rest of the state government officials who did a really good job on that. We're going to see a drop in our premiums. Well, they've gone up over 200%, so a drop is certainly welcome. But in other states right now, holy cow, there are things that are happening, as we speak in places like Iowa. I think South Carolina, they just announced a 40% increase in their premiums. If there's still things that are happening, if markets are starting to collapse, maybe there will be another attempt at this, but I don't think there's going to be anything prior to the end of the year. But look, we're still going to be working on it. We're still going to be trying to work with all of you on your ideas. But for right now, I think that the effort until the end of the year is going to be put on hold.
You had mentioned our introduction, and certainly my view of watching as an outsider is that you've been an effective advocate for Alaska on this issue, but as we said, behind the scenes, certainly relative to Senator Murkowski, who was much more prominent because of her early opposition to the House version and then ultimately the Senate vote, how would you grade or comment on Senator Murkowski's performance during this process when she faced tremendous pressure from national and state figures because of her position?
Well, look, Senator Murkowski and I and our staffs work closely, literally on every issue, right? And Don Young. I mean, the one thing that I think most Alaskans see is across the board, we are daily, even hourly, working together on really everything that impacts the state. From my perspective, we just took a bit of a different approach on this. A lot of the things that we were working on, I didn't feel in some of those I mentioned. There was a whole bunch of other working on, primarily focused on Alaska. My own view on that was, I felt if I was talking about them in the press, it would undermine my opportunity our opportunity to get them done. And so that's why our approach was very much focused on just working it. I wouldn't say behind the scenes, but just kind of not really talking too much to the press. And in some ways, I think that in some ways it may have hurt us because we weren't able to explain a lot of what we thought were positive elements. Even Graham Cassidy, I mean, an FMAP moving from 50 to 65%, that's in the bill. That's an enormous benefit to our state. And, but look, I'm not going to grade my colleague. She and I work on things. She was under a lot of pressure. And what we were both trying to do was figure out in our sincere what was best for our constituents. And I know that's how she feels and how she works. That's how I feel and I work. And, we're continuing to work on this on Graham Cassidy. She and I and the state were meeting with people jointly. Our teams were meeting with people jointly for, the whole run up to that. And I anticipate we'll continue to operate that way.
Let me ask, I know we're getting short on time, but I have found it through observation and experience that it's extraordinarily difficult to come up with good solutions, particularly at the federal level when it comes to a largely state-based healthcare system. Solutions are few, problems are many. Do you feel like you're getting enough creativity from the healthcare sector? I mean, if the 200 plus folks in the room started sending you ideas, would that be welcome? Or do you feel like you've got enough ideas, you got to figure out how to coalesce around a handful?
Oh, absolutely, it would be welcome. I mean, I think some of our best ideas are from the people in the room. And my only ask of everybody there is please keep them coming. And we want to keep working with you constructively. I would say, though, it would also be helpful. One of the frustrations that I saw is as soon as a bill came out, there would be certain groups that came out and said, oh, my God, this is going to do X, Y, and Z. They analyze things in very, I think, ways that weren't always accurate. Heck, even the CBO score on some of this, they talked about how this is going to yank, millions and millions of people off healthcare. I mean, the vast majority of the people they estimated who were not going to, be pushed off healthcare were actually people who CBO estimated were going to, if they had the choice without an individual mandate, they wouldn't take it because it was too expensive. That's a very different thing than being pushed off healthcare by a bill. And yet those nuances were rarely analyzed and focused on. It would be kind of the first think tank to the press with some kind of estimate that 99 times out of 10 were off the mark. I think the ability of all of us to work together on detailed analysis is really important, and we know that everybody in the room believes that as well. We want to work with you on doing that. Please keep the engagement with us coming. And again, I want to thank everybody in the room, because we have spent thousands of hours with the folks there collectively, and I know how much they care about healthcare in Alaska, and so do we, and we want to keep working with everybody.
You know the line that there are workhorses and there are show horses. I think you've demonstrated in your 2.5 years that you are very much a workhorse for folks in Alaska. I appreciate you being with us today, and keep on keeping on. Let us know how we can help you.
Thank you very much.